Thank you for attending this webinar, which will provide guidance on how to complete the DDA Provider Application currently posted on DDA's website. This presentation will help clarify DDA's Provider Application approval and Medicaid assistance provider re-enrollment processes. I will review the content of the DDA Provider Application with you and the information required when an application is submitted. Shortly following this webinar, the DDA will provide an opportunity for those attending to engage in a question and answer session to provide additional information regarding DDA's application requirements and medical assistance provider enrollment processes. By providing the information in this webinar, the DDA expects the following goals to be met: that there will be a decrease in the number of requests made to providers from regional office reviewers to seek information omitted but required in the DDA Provider Application, and that the average time period for approval of a provider application will decrease. DDA's service delivery system has changed. DDA has 2 new support waivers so applicants can use the application to seek approval to render services in these waivers. DDA is changing the services that are included in its Community Pathways Comprehensive Waiver so applicants can use the application to seek approval to render the new services. Applicants can also seek approval to render current services. Most of DDA's waiver services have new eligibility requirements, and there are new billing, codes, and payment procedures. Requirements in the DDA Provider Application are in each applicable CMS waiver application, which, in addition to DDA, has been approved by the State Medical Assistance Office, also referred to as the Office of Health Services, and subsequently approved by the Centers for Medicare and Medicaid Services, which is also referred to as CMS. Service categories such as Family and Individual Support Services, Individual Support Services, Community Supported Living Arrangements are now obsolete, and services previously in these categories have been unbundled. Joint review and approval processes with DDA and the Office of Healthcare Quality have changed. Only services rendered in provider-operated sites such as day habilitation, career exploration, which was formerly called vocational services, community living group home, and community living enhanced supports will require a DDA license, which will be issued by the Office of Healthcare Quality. Providers who render services to participants and self-directed services are approved by their FMS. Application processes for licensed providers and providers who are seeking approval to render DDA-funded services which do not require a license will be discussed during this webinar. Prior to starting completion of the DDA Provider Application, providers are asked to review the eligibility requirements for Qualified Service Support Providers, or QSPs, and DDA's home and community-based waivers, DDA's policy on application and approval processes for QSPs, and to review instructions for completing the provider application. These documents are posted on DDA's website, the eligibility requirements for qualified service providers. This document lists the services provided in each of DDA's waivers, and it specifies the service descriptions, provider and provider staff eligibility requirements to render each service. A DDA license is also required to render targeted case management services, which are also referred to as coordination of community services. The DDA Provider Application can be used by a variety of applicants seeking approval to render licensed services and services which do not require a license. DDA providers must also be medical assistant providers, to render waiver services. New service descriptions, provider eligibility requirements, billing and payment procedures require that each current provider be enrolled as a medical assistance provider by April 30th, 2018. You can use the DDA Provider Application to obtain approval from DDA to be re-enrolled as a medical assistance provider. An initial applicant must use the application to be approved by the DDA to render services in DDA's waivers first. This approval is required prior to obtaining a medical assistance number to provide DDA waiver services. To re-enroll a current provider with a medical assistance number, DDA must verify that the provider meets the new eligibility requirements in its waivers and identify each service the provider is approved to render. This information is included in a provider's approval letter, which is sent from the regional office. The provider's approval letter is also sent to the Office of Health Services Waiver Services Division for the provider's re-enrollment. After the current medical assistant re-enrollment process has been completed for licensed and other DDA-approved providers, the provider will return to the renewal application processes based on approval expiration dates on DDA's approval letter or the DDA license and requirements in COMAR 1022-02. New providers should, if seeking a license, continue the next phase of the licensing process with the Office of Healthcare Quality. If approved to render services which do not require a license, complete the medical assistance provider application and submit it to DDA's headquarters. For the current medical assistance process, when an applicant's medical assistant application is received, DDA will review it and submit it to the Office of Health Services Waiver Services Division as appropriate, so that the applicant can obtain a medical assistance number. This final step will change once medical assistance provider application submission processes require electronic submission of forms directly to the Office of Health Services. Finally, Code of Maryland Regulation 1022-02 requires that DDA licensed providers have their licenses renewed each year. Currently, DDA-approved providers who render services which do not require a license to waiver participants must also have their approvals renewed each year. The DDA Provider Application has been merged with the Office of Healthcare Quality's application. For calendar year 2018 only, if a provider used the current DDA Provider Application, which has been merged with the Office of Healthcare Quality application for their medical assistance re-enrollment, the renewal application form does not have to be completed. Office of Healthcare Quality staff has access to your medical assistance provider re-enrollment application and DDA's approval of it. Office of Healthcare Quality's License Coordinator will simply request that you provide updated information for your license renewal, such as information pertaining to any changes in your agency's staffing, your agency's residential or day program sites, information pertaining to your staff's criminal history or background checks, training of staff, and other requirements. Code of Maryland Regulations 1022-02 requires that current DDA providers submit their renewal application 60 days before the date of their licenses or approvals expire. For renewals, licensed providers previously used the form generated by the Office of Healthcare Quality and approval term dates identified by this agency. During calendar year 2019, all providers will return to renewal application submission requirements based on their approval expiration dates and based on regulatory requirements and DDA policy. The DDA application changed so that there is one single DDA provider application. The application can be used by initial applicants. The application is also used for DDA approved and licensed provider renewals. The application now includes OHC required information, so it replaces the OHCQ provider application form. The DDA application can be used by each provider type. So an individual with no employees seeking to render services in DDA's waiver, as well as a business agency that is not licensed, and DDA licensed providers can use the form. The DDA application form can also be used for other purposes, such as a current provider can use it to seek approval to render added waiver services or to render services in another waiver. Now that I have shared with you DDA's provider enrollment and medical assistance provider re-enrollment processes and factors contributing to the revisions to the DDA provider application form, let's now review it together. All applicants must complete pages 1 to 12 and provide applicable attachments on page 13. A business agency must also complete the Business Agency Questionnaire Form, pages 14 to 17, and provide applicable attachments on page 18. Initial or renewal license applicants must complete the Governing Body Board of Directors Form, Staff Training, Criminal History, Policies and Procedures Form, and the List of Licensed Site Locations Form. Finally, if you are an applicant applying as an initial residential child care provider, please provide information on page 19. In number 1A, please indicate if you are applying as an individual applicant with no employees, a business agency, or as an organized healthcare delivery system applicant. The OHCDS designation means that you are an agency or you are applying for approval to contract or subcontract with vendors who will ensure that they meet the applicable eligibility criteria for OHCDS designation. If you are applying for OHCDS approval, you must also complete the OHCDS form and submit it with your application. Please indicate in 1B which waiver in which you will render services. You can choose to render services in all 3 of DDA's waivers. However, to render services in DDA's Family Supports Waiver, there are additional child protective services, clearance, and background checks which must be met and submitted with your application. For 1C, the DDA application has multi-uses, so please check all that apply. For calendar year 2018, if you're using the application for Medicaid assistance or medical assistance provider re-enrollment processes, please check Other and specify this purpose in the space allocated. In 1D, please indicate whether you will render services to children, adults only, or both children and adults. If you choose to render services in the Family Supports Waiver, this waiver serves children. You will not be approved to render services in the Family Supports Waiver if you select adults only or do not provide the appropriate child protective services clearance and criminal history checks. Information required in 1E through 1Q is relative to your business or agency. Some applicants may have sole proprietorships and may want to do business with DDA using another trade name. Also, some applicants may have parent companies and do business with DDA as subsidiaries of these companies. Under Maryland law, these businesses are required to record their trade names with the State of Maryland's Department of Taxation and Assessment Office. If you apply to do business as using your trade name, DDA will need proof of your filing with the Maryland Department of Taxation and Assessment. DDA providers aren't required to have a National Provider Identifier, or NPI. The NPI is a 10-digit identification number which is issued to healthcare providers in the United States by the CMS. Certain healthcare providers, all health plans, and healthcare clearinghouses must have NPIs in their administrative and financial transactions. This information is useful for the Office of Health Services, who oversees the State Medical Assistance Services program. So, if you have an NPI number, please provide it in the space designated in the application. Now, please continue to complete Section 1, providing all relative business information, and then proceed to Section 2. In Section 2, services have been unbundled. So, if you are a licensed provider or have been approved to render services previously included under Family and Individual Support Services, or Community Supported Living Arrangement categories, you will need to check those services in 2A, which you will render. When you complete your license renewal, your new license will only reflect licensed services. DDA's approval letter will continue to reflect both licensed and other DDA-approved services. DDA Community Development Services were previously titled Community Learning Services. If you provided employment discovery and customization services, you will maintain your enrollment to provide these services. However, effective in July 2019, employment services will be unbundled. So you and your staff need to meet the eligibility service requirements to render each employment service and each specific unbundled employment service specified in your program service plan. Please indicate if you will render any DDA-approved family support services. Some of these services were bundled under previous Family and Individual Support Services, Individual Support Services, and Community Supported Living Arrangements. Nursing services are stand-alone services and are not included in the residential rate. If you intend to provide nursing services, you will need to seek approval for these services. Please check OHCDS services you will provide, and again, be sure to complete and submit the OHCDS form in your application. Effective 1/1/2018, providers can only be approved to render new services and supports in DDA's waivers and locations and sites which meet the federal community settings rule. Community setting rule requirements are in the Frequently Asked Questions document, which is posted on DDA's website. DDA has a joint site evaluation process with the Office of Healthcare Quality. All new sites are inspected by OHCQ's Physical Site Inspector. Provider-operated sites, both new and old, will also be visited and evaluated by regional office staff members to determine compliance with the federal community settings rule. Before a site can be licensed or approval of a new site is issued by the Office of Healthcare Quality, the DDA regional staff must visit the site and determine if that site meets the federal community setting rule. In order to continue to provide services to participants in DDA's comprehensive waiver, a provider operating a site which does not comply with the community settings rule must have a transition plan approved by the DDA. Site visits will also occur to these provider-operated sites to evaluate actions towards compliance with the federal community settings rule and for your continued approval of your transition plan. In Section 2, letters B and C, please indicate if you have any current applications pending so that DDA can consider all information in these applications along with the current DDA Provider Application. In Section 2D, please check the counties in which you will render services to DDA waiver participants. Let's move to Section 3. Individual applicants must enter the information required in Section 3 or attach a resume which has the required information. DDA license providers or other business agencies should skip this section and complete the business agency questionnaire and information form. This form requires submission of resumes for applicable agency staff which demonstrate education, license, certification, and experience requirements are met. Moving on to Section 4, in letter A, please indicate if you are the sole owner of your business. If you are, please provide your Social Security number in the designated space. If you are not, please indicate your role and provide for each direct or indirect business owner the information requested. In letter B, if you are an individual applicant with no employees, please indicate if you have submitted 3 professional references in your application. Business agencies do not have to provide these references as they are required to submit the business agency questionnaire form. In letters C and D, these items seek information useful to DDA for planning or reporting purposes and for responses to inquiries regarding DDA's providers. Your business does not have to be credentialed or have distinct specialty services other than what is required in the provider eligibility requirements. Letters E and F address insurance requirements. You must indicate if you have general commercial liability insurance. If you do, please specify your vendor, your policy number, and coverage dates, and submit this information and copies of your coverage pages and label them as Attachment 11. You can only be approved without this coverage if you do not have employees. In the provider agreement to the conditions of participation, you will attest that you will meet all provider requirements. Before the applicable regional office approves your application to render services or approves you to start to render a service, you must submit proof that you have appropriate liability insurance coverage. You must also provide proof of automobile insurance coverage for all cars which will be used to provide the direct service, and provide copies of coverage pages and label them as Attachment 12. Information in letters G and H help the DDA to determine your capacity to deliver services to DDA waiver participants if you are rendering services or had been previously approved to render services to other populations. Letter G asks for specific information in regards to licenses or approvals you have with other Maryland state or out-of-state government agencies. And letter H asks specifics about contracts or funding from Maryland State or out-of-state government agencies for other populations. Letter I seeks information in regard to those individuals who make decisions regarding your overall operations. This information is required for an individual applicant and for a business agency that seeks approval to provide services which do not require a license. Licensed providers must comply with COMAR 1022-08, which has specific requirements for a governing body. However, if your licensed agency has individuals who approve your agency's overall operations, in addition to your governing body, please enter this information in letter I. Individual applicants should complete letter J only. Please describe in the space allocated how you will support individuals with developmental disabilities to live a life as diverse and enriching as others who live in their communities. Business agencies can skip this question as this information is required in your program service plan. Letters K and L solicit information which pertains to provider-operated sites and these sites' compliance to the Federal Community Settings Rule. Please enter not applicable in the space if you are not operating a site. If you operate a site and your response is no, please specify if you have an approved transition plan with the DDA. You can only be approved to render services in your current facility-operated sites to participants in DDA's comprehensive waiver if you have a DDA-approved transition plan. As previously indicated, you cannot render services to participants in DDA's community supports waiver if your day program and vocational sites do not meet the community settings rule. Letter M pertains to an individual applicant. Please describe how you will ensure that individuals will have input regarding the services and supports that you will provide. Business agencies can skip this question as this information is required in your program service plan. Letters N and O pertain to fiscal responsibility and your fiscal operating practices. If you replied no to either of these questions, please explain your circumstances and the space allocated. DDA's application evaluation processes require that you demonstrate sound fiscal responsibilities and practices to be approved as a qualified service provider. Letters P, Q, R, S, T gauges your ethical practices or your business's ethical practices. The applicant's and your managerial staff's criminal history and background and exclusion check information. You must ensure the provision of criminal history background and exclusion checks as required by this application in letters S and T. Please ensure that you have met the requirements. DDA defines a current background check for an applicant or for the applicant's first-line managers as one which is received from the CGIS no more than 45 days after the date it was requested and received by DDA headquarters within 30 days of receipt of your provider application. First-line managers are those who have managerial responsibility and oversight of the services rendered in DDA's waivers. In the performance of these duties, first-line managers have direct contacts with waiver participants. Therefore, for new applicants, the applicant's CEO or executive director or for an individual solely rendering services, and for the applicant's first-line managers, there must be current criminal history and background checks from CJIS. You must use DDA's authorization and ORI numbers so that this information is submitted directly to the DDA. Please indicate that you are requesting the criminal history report for government licensing or certification. Each applicant must also submit the provider agreement to the conditions of participation, attesting that he or she will ensure criminal history or background checks for participants, for staff, in compliance to Health General Article 19-1901, Annotated Code of Maryland, for staff again, and for volunteers, board members, contractors, or subcontractors who have direct contacts with participants. If the applicant intends to render services to children, a Child Protective Service clearance letter from your local Department of Social Services is required for the applicant, CEO, Executive Director, and the same is required for all of your first-line managers. Current license providers seeking approval to become supports waiver providers or to render new services and DDA's comprehensive community pathways waiver, which you were not previously approved, must meet the same requirements and have current criminal history or background checks from CJIS. Therefore, a current provider's CEO or executive director and the provider's first-line managers who have oversight for those services in which approval is sought must have current criminal history and background checks. If you are seeking approval to render services to children, a current provider's CEO and executive director and the current provider's first-line managers must also have Child Protective Services clearances from the local DSS, and this information should be included in your provider application. Finally, the CEO or executive director for a current provider must also submit the provider agreement to the conditions of participation, attesting that he or she will ensure criminal history or background checks for all provider staff, volunteers, board members, contractors, subcontractors who have direct contacts with participants in compliance to Health General Article 19-1901, Annotated Code of Maryland. To meet criminal history and background check requirements in the application, an applicant should request the required criminal history checks from CJIS and Child Protective Service clearance from your local DSS at least 2 weeks prior to the submission of your DDA provider application. The DDA agency authorization number is a 10-digit number. This number is 1500001484. The ORI number is MD00311057. You can also visit this website, https://dhr.maryland.gov to order or to request your Child Protective Service clearances for yourself as applicant and for your staff. Now that you have completed these sections of the DDA Provider Application, an individual applicant, an applicant with no employees, should sign the disclaimer and date it, and all applicants should progress to page 13, which specifies the required attachments for all participants. Individual applicants should complete the provided checklist and ensure that all requirements and attachments on page 13 are included. After doing so, individual applicants can stop because you have now completed the DDA Provider Application and are ready to submit it to the DDA. Business agencies should proceed to the Business Agency Questionnaire and Information Form. The first requirement for the Business Agency Questionnaire and Information Form is the Program Service Plan. A Program Service Plan and a QA plan must be submitted for all new agency applicants and updated for all current licensed providers. Licensed providers should have a current PSP, or a DDA approved business agency should have a current PSP as required by COMI 1022-0209, which has been approved by your applicable region. You must update your PSP to include the new service categories and/or descriptions if they have changed, and DDA's waivers, and to add new services and the relevant information pertaining to those services. The DDA has determined each provider's capacity to deliver services previously approved. But for new services, the DDA has to determine each provider's capacity to deliver those services. In addition to the current services, names and descriptions, locations in which services are delivered, and information which pertains to staffing, you must now provide this information for all new services. Please also submit your agency's organizational chart or staffing plan. This information should identify your first-line managers by name and position and the covered services they oversee. Along with providing this designated staffing information, you must submit copies of degrees for staff if they are needed to establish that eligibility requirements are met, and resumes for staff, as well as resume for yourself as an applicant to substantiate that required experience has been met. If positions are vacant in your agency or you do not have staff in place, you must also submit job descriptions for those positions reflecting compliance to eligibility criteria and provide dates when staff will be hired and start dates for new services. Current providers should modify any job descriptions as needed for compliance to eligibility requirements and DDA's waivers. Finally, you must specify or project the number of participants who are receiving or who will receive the covered service and identify staff positions by numbers that will render the direct service. Based on the contents of your PSP, which you have submitted, and the DDA Provider Application, the DDA regional staff may choose to update your Program Service Plan or PSP approval date and issue you a new PSP approval letter. They can also choose to provide a provisional approval of your application pending submission of a PSP with changes based on the feedback or recommendations which have been made from your region. Finally, the DDA regional staff may choose to deny approval of your current application if there are significant compliance issues with requirements in COMI 1022-0209 and the provider eligibility requirements in this DDA application. All business agency applicants must have a quality assurance plan. New applicants must submit a quality assurance plan in their applications. Applicants seeking to renew their license or DDA approval to render services and supports must submit a quality assurance plan with signatures and dates which reflect approval, an annual review from their governing body members, the CEO, or an administrator, or a current licensed provider or DDA approved provider can submit a copy of their current approval letter for your QA plan from your DDA regional office. Your QA plan must include the contents of the requirements under this section. Your QA plan must denote your governing body members' qualifications and roles, frequency of meetings that they hold, and that minutes are published. And at any time, DDA may ask for copies of these minutes. If you are a business agency seeking approval for services which do not require a license, DDA will determine if your QA plan explains how your business is governed and whether it identifies the roles for person who hold authority in your business organization. Your QA plan should also provide information to determine how it was developed. Letter C asks you to indicate if your quality assurance plan is included in this application, and if so, please label it as Attachment 20. When submitting your QA plan, however, please ensure that components that are listed in letter D are addressed. Number 7 asks you to describe in detail your experience in operating a business. If you do not have this experience, please describe how you will obtain the expertise needed to provide the services in which you are seeking approval. In Section 5, you are required to provide fiscal information. In Section 4, for business and finances, letter A indicates that if you are a DDA license, if a DDA license or approval is granted to your new business or agency, payment for services and supports may not be received for up to 180 days from the date of service initiation. You will incur operating expenses during this period. Initial applicants, therefore, must submit the business agency's proposed budget for the first year of services and a projected budget for the next year. If you are a business agency renewing your DDA approval or license, you must submit your current budget and fiscal verification forms. Fiscal verification forms are also called financial incident reports. This information can be found on this website link, https://dda.health.maryland.gov, with this additional information for the website link. Please ensure that for all budgets submitted, your budget includes the following components. In letter A, 2A, your budget should include costs incurred from specific positions and employee salaries, taxes, equipment, insurance, space, travel, transportation, training, and supplies, and any other costs associated with personnel. And B, please ensure that your budget includes sources and amounts of startup funds for initial applicants. Information provided must include verification of income in the form of a current letter, which is dated within 30 days of submission of your application, from an accredited bank or other financial institution documenting a line of credit, business loan, or availability of funds. Finally, your budget should include all sources of income, so all sources and income from those sources, and detail any fundraising activities. Finally, to look at your budget and finances, all applicants are also required to submit their tax forms as required in Attachment 14. In letter B, please explain how your business agency will ensure sound fiscal operation. In letter C, please explain how your business is addressing any outstanding debts or disallowances from the DDA, other state and/or federal agency if you respond yes to this question. Applicants applying as designated organized healthcare delivery systems or OHCDSs again can subcontract or contract with Medicaid and non-Medicaid providers to allow individuals to receive services approved in their individual plans in a manner which best suits their needs. To qualify as an OHCDS, an applicant does not need to be a licensed provider. However, the applicant must provide at least one Medicaid service. Also, the applicant must be enrolled as a Medicaid provider or medical assistance provider and render that medical assistance service directly. Lastly, the provider must meet other requirements in COMAR 1022-20. Please indicate if you are applying as a designated organized healthcare delivery system, again here, and complete the organized healthcare delivery system form and submit it with your application. Now that you have completed most of the requirements in the agency business questionnaire form, you are now ready to complete the provider checklist. Therefore, in addition to ensuring that all attachments on page 13 have been included in your application, you must also ensure that this agency questionnaire form is included. You must ensure that your program service plan is included, and if you have a letter, an approval letter for the transition plan from your regional office for any sites not meeting the community settings rule, please label your program service plan and your community settings rule letter as attachment 17. Also, you must make sure that you have provided a copy of your workers' insurance compensation information and label that as attachment 18. Unemployment insurance coverage copies of your coverage terms should be labeled as attachment 19. Your quality assurance plan should be included, or your approval letter, and label that as attachment 20. All your budgets verification forms or your financial verification forms, also called financial incident reporting forms, should be labeled as attachment 21, and please submit your organized healthcare delivery system form. After you have completed your provider checklist and ensured that all attachments are included, if you are not completing a renewal, you should now proceed back to page 12 and sign the disclaimer. Also, you will need to sign this signature space as indicated here and date your application. In addition to completing this DDA provider application for the medical assistance provider re-enrollment, as well as for their license renewal or DDA approval renewal, please complete, as applicable, your governing body board of directors form, the staff training form. These forms must be updated. Staff training forms, staff criminal history form, staff policies and procedure form, list of licensed site location forms, and any addendum applications you may choose to make to add a new site. Once you have completed and provided these forms, again, please ensure that your application is signed and dated. You are now ready to submit your application to the DDA office unless you are applying as a residential child care provider. If you are applying as a residential child care provider, you must submit all documents that are required on page 18. Next steps. Once an applicant is approved, the following actions shall occur. An initial applicant, if you are applying to provide licensed services, the initial applicant shall contact the Office of Healthcare Quality and complete the next phase of the joint licensing process. If you are rendering services which do not require a license, an initial applicant should complete the Medical Assistance Provider Application and submit it to the DDA. Renewal applicants. During calendar year 2018, you have provided updated information in your Medical Assistance Provider re-enrollment application. Office of Healthcare Quality staff has access to your Medical Assistance Provider re-enrollment application. If you use the DDA Provider Application dated February 27, 2018, you will be contacted by the Office of Healthcare Quality for any information needed to update your application. If you did not complete or use the new DDA Provider Application, you will need to submit the Governing Body Board of Directors form, the Staff Criminal History form, staff training forms, and all other OHCQ forms if you have not already done so when your renewal is due. If you used another application form, the OHCQ will still use that form to process your license renewal. However, in addition to submitting the Governing Body Board of Directors forms, staff criminal history form, and staff training forms, and other forms that the OHCQ uses, you may be required to submit additional supplemental information needed. In calendar year 2019, all renewal applicants, whether licensed or DDA solely approved, must use the current DDA provider application. No other application forms will be processed. If you are seeking approval to operate a new site, whether it's a residential site or a day program or site associated with providing day services, the site must be in compliance with the Federal Community Settings Rule. DDA regional staff will conduct a site visit to determine compliance to this rule before OHCQ issues a site license to you. A provider enrollment and compliance team member from the Office of Health Services may also conduct a site visit to determine your compliance to the state's waiver requirements. Finally, there will be a question and answer session for participants attending this webinar. It will be scheduled in the upcoming weeks. Please submit any questions you have directly related to DDA's provider application requirements to leslie.smith@maryland.gov. Thank you for attending this webinar.